Hey guys, Derek from Myofascial Mobility Systems. Today we're just going to share with you a quick video that we just shot on treating somebody with knee pain or PFPS, with most of the pain originating on the medial side of the patella and underneath. So we're just going to show you a few quick things on how to treat that and how to get underneath that patella and get rid of some of that restriction and adhesions underneath there. Okay, so when we're treating somebody with knee pain or PFPS or anything like that, a lot of the time, obviously, the improper mechanics are coming from up top in the hip, and they're transferring down, and we have tight IT band, all that kind of stuff. But a lot of people are still complaining about knee pain underneath the kneecap, especially on this medial side. So what we do to treat that, we're going to treat the entire chain. We're going to start strengthening glutes on her here today. And we're also going to loosen up the IT band. The first thing we're going to do is kind of take care of any of that, the restrictions, the adhesions underneath that medial side of the patella. So the way we're going to do that is we're going to take our M2T-Blade. We're going to get a little bit of cocoa butter on it, and we're going to put it right on that medial side of the leg, right beside the patella, and even up into that VMO a little bit. Okay? And now the easiest way to get underneath there is that we're going to push that kneecap immediately with our thumb. With a lot of people, we're going to find that we have a lot of skin slack sitting at the top when we do that. So to get rid of that, we're going to push immediately with our thumb and pinch and pull that skin out of the way with our finger. With this is the one time where it's going to look a little bit different than most of the strokes we use. We're going to use almost like a little bit of a can opener, as I like to call it, and really get underneath that kneecap. And this should help clear up a lot of those restrictions and feelings that she's feeling when she's bending the knee. We're going to work our way around from the distal portion all the way up. Okay? Once we feel like we've warmed up that tissue a little bit, if we want to get a little bit deeper, what we can do is we can take this point right here on the end. We're going to cover it with our finger just on the top to kind of guide us. Again, push that over, take the skin slack away, and we're going to work our way right up underneath in there. So any of that crepitus that she's feeling when we're playing with the kneecap, this is actually going to take care of a lot of that. But like we said before, this isn't really the cause of her issue. So what we're going to do is we're going to expand the treatment zone there as well, because we never just want to treat that one spot that she's complaining about the pain. So with her, we tested her VMO, and it's a little bit weak. So what we'll do is we'll take a couple broad strokes to that VMO. We're not really trying to break up any sort of restrictions in this area because there aren't too many on her. But what this is going to do is now when we go back into the gym and do a little bit of rehab with her, that VMO is going to start to activate a little bit better. Okay. Again, we're just doing a little bit more superficial work on that VMO after we did the deep work on that patella. Good. And the next thing we're going to do is we're going to end up treating that distal portion of the IT band, so I'm going to get her to roll onto her side. Obviously, we can play with the tension a little bit, so if we drop this a little bit further down towards the ground, we're getting a little bit more tension on there. But we're going to work with it this way. So a lot of times I would be sitting in front, but obviously if I do that, I would be in your guys' way. So I'll work from behind her today. We're going to get a little bit of emollient cocoa butter on that IT band. And again, we're going to start with that superficial edge, so that 35-degree edge with the logo facing up. And we're going to work that IT band and see if we can find any nice restrictions in the area. A lot of the time we're going to find a little bit more in that posterior portion of the IT band. Good. Good. And again, a lot of the times what we'll find is a little bit of restriction, adhesion between that IT band and that bicep femoris tendon. So we always want to look for a nice little gap there, and a lot of times that's going to restrict her motion in the knee as well. So with her, we can feel that there's not that nice separation between, and there is a little bit of restriction in between. So we're going to take this point right here, our number 6, and we kind of roll off right off the back of that IT band and really start separating those two. Okay, it's not the most comfortable area to work on because it is very superficial, but we're going to start breaking up the scar tissue in there, and that's going to allow us to get a little bit more movement outside of that knee. Okay.